Okay, good morning, everybody, and welcome to Certipay's 14th coffee break. We are so happy to have you join us this morning. I am Rachel Camella, your host, and I am here with Cindy Merkel from our HR team. She is our moderator this morning. And I see some other members from the Certipay team, as well as some returning clients and some even potential clients. So we are glad you're all joining us for these coffee breaks. And we hope that we're giving you useful and valuable information. If there's a topic that you would like us to cover, please let us know. We will create a coffee break on any topics you think are relevant and important right now. That's the intention. So let's roll. We are talking about COVID and your policies and maybe the need to look into some new policies and maybe answer some questions about your policies. So this is what we're going to talk about today. A lot of these came from questions that came up last week. So somebody asked about, can we get waivers from our employees to return to work? We're going to also cover some safety and mask questions, PTO, vacation, accrued time, what to do with it, and then remote working policies, and what about managing or monitoring off-duty behavior. So I think we'll have some interesting things to say. Let's start with waivers. So this question came up last week, and it's really a good question because of the pandemic and because of the situations that we're all in right now. So can you ask your employees to sign a waiver about returning to work? It's really simple. No, you cannot. And that is because of the OSHA General Duty Clause. It is our obligation as a business owner. It is your obligation as a business owner to create a safe environment for your employees. And so asking them to sign a waiver, we know we might end up in danger if we return to work, is contradictory to the General Duty Clause. So you cannot do that. But it doesn't mean there aren't things you can do to safeguard yourself. So there are things to do. First of all, implement safety protocols. And we're going to talk more about that when we talk about safety in more detail. But have safety measures in place, have protocols in place, and then make sure your employees are aware of what they are, and even sign an acknowledgement that says, I understand what the safety measures are that we must all follow at this company upon my return. I acknowledge that I received training and information about that, and I acknowledge that I will follow them. So then you have some protection. So the other thing that OSHA has said is that it's very hard to really figure out where somebody's contracting COVID-19, short of working in the healthcare industry or being a first responder. So for the general businesses, it's pretty hard to pinpoint unless you exactly know that somebody had COVID-19 and you placed your employee in that direct contact. Otherwise, it's hard to tell where it came from. So all you have to do is take some steps, put safety protocols in place, have a procedure and policy written about that, have your employees acknowledge it, and you're protecting yourself. That's your waiver. So talking about safety, whoops, somebody put us on hold. Okay, so when we talk about safety, you probably already have safety protocols in place as well. You probably already have some kind of a high-level safety policy. So take a look at your policy. Make sure you understand exactly what's in your current policy and see if you want to add an addendum about COVID-19 or if you want to change your policy for now. But it's okay to do that. Have some additional language specific about safety and maybe even about clothing that will be worn, PPE that will be worn or provided or expected, masks that will be part of your new uniform or your COVID era uniform, whatever it is. But write it down. Add it to your policy, add it as an addition to your policy, tweak your policy, whatever you need to do. Let's get that in there. And then have a training, get everybody together. I spoke with one of the clients yesterday and she said that they've been doing 2 safety trainings a month, very specific to their protocols. And then they have a weekly, just a 5-minute recap about protocols. I think this is a great idea. Anything that you guys can do to add some additional training and information about your protocols, and that will help protect you as well. Hang posters up in the break room, by the time clock, any place that somebody can see it. But take steps to make sure your employees are aware of what your policies are. And there's a couple of great things that happen. Not only are you educating and informing your employees about your safety protocols, you're also creating a comfort level for the employees. So other employees can see, oh, this is what we do here. Oh, these are the steps we've taken. We have a client in the restaurant industry, and they have really gone above and beyond. They've done some great things in their restaurant, taking some significant steps, having lots of trainings, providing lots of PPE for the staff, and creating social distance in their restaurant. They were one of the restaurants that opened very slowly and very carefully, only half occupancy, and making some real steps to protect themselves. And as a result, they have increased their business. They have a lot of security and safety. The customers are happy coming there and comfortable because they see all the safety that precautions they've taken, and the employees are happy working there because they know that the owners of the restaurant are really looking out for them. So adding safety protocols and measures really gives your other employees a real sense of safety and security. So it's a good move to do. And again, get that acknowledgement signed. And it's okay if these are short-term policies. It's okay to say, this is our safety practice. These are the PPE requirements for now, subject to change, whatever that means. And again, we know things are changing by the day, and that's an important note. All of these things are for now, just for basically today. Maybe different later today, it'll probably be different tomorrow, but these are good things to put in place, and that's why you have the trainings and you have the acknowledgements and understanding, have the conversations. It's important. So when we talk about masks, you can add this to your uniform. If you have a uniform policy, take a look at the writing in your uniform policy, add masks to it. And again, this might be something that we're just doing right now. And because we're actually in a national pandemic, the mask wearing is something that really can be something required. So we all have different state requirements, different jurisdiction requirements. Make sure you know what those are. And we have some states where they say you must wear a mask if you're moving about in public, if you cannot social distance, whatever these pieces are. So your business may not have a choice right now. You may have to require masks. So you have employees who you're telling them, this is part of our uniform right now. We have to do it. And the expectation is that you do it. The other employees expect that they will see their fellow employees wearing masks. So the question comes up about ADA requirements. What if I have somebody who refuses to wear a mask because they have a medical condition? Well, that's okay. It's okay to say, I've got this medical condition. And so you want to have a conversation with them and figure out what is going on, okay? What kind of an accommodation can we make for this person? Well, just because somebody says they cannot wear a mask doesn't mean they just no longer wear a mask. It means we're going to make an accommodation for them, and that might mean they have to stay home. If you cannot make an accommodation for somebody wearing a mask and they would be around other individuals and it would not create the safety that we need to create right now, then maybe making an accommodation isn't possible. Now, I'm not saying this is the end all be all. I'm saying we have to have the conversation with that person. and make sure that we can figure out what the accommodation is. Can the person work from home where they're not around other people and they don't have to wear a mask? Or are they just saying they don't want to wear a mask? There's no underlying medical situation. There's no ADA issue. The person just doesn't want to wear a mask. That's okay too. If they just don't want to wear a mask, that is a choice. What they're saying is they don't necessarily want to work there. If your company is requiring masks as a part of the uniform, then that's the uniform. So it's the same thing. If your uniform is a blue shirt and khaki pants and they say, I refuse to wear a blue shirt, then they're just not at the right place. They don't have to wear a blue shirt because they don't have to work there. It's really kind of simple. It doesn't have to be much bigger than that. So when masks are required and you've adopted masks as part of your uniform, that's something we want to put in the policy. Again, it could be a temporary policy. We're going to wear masks as part of our uniform until further notice, or while this country's in a pandemic, whatever it is. So add an acknowledgement paper for that just says, this is our new uniform until further notice. So you may have customers who refuse to wear a mask. Same thing. This is a choice. A customer may choose to not wear a mask, but if the policy in your business is that you're asking people to wear a mask, then again, we're going to have a conversation. Okay, I understand you don't want to wear a mask. That's fine. Let me get the products for you and bring them outside to you. That might be an option. Think of other ways to help the customer. Certainly, we don't want to lose any customers, but we don't want to put any of our other customers or employees in jeopardy. So think about how you can do that. You know, is there some accommodation you can make to keep this person as a customer, but not jeopardize anyone else's health and safety? And it may also mean, I'm sorry, masks are required right now. We're asking everyone to have a mask in our establishment. If you don't want to wear a mask, you can't be here. It might come to that. But again, have a conversation. There's no just simple black and white on this. It's a little bit gray. So take the time to have the conversations, and I think you can, in most cases, you can come up with a solution. Again, going back to the example of a restaurant, is it possible to take the individual's order remotely or keep them outside, take their order, and then bring them to go, whatever it is? That's just one example of an option. But be creative and have the conversation. Remember, state guidelines are different, and follow CDC guidelines and use the CDC guidelines in that defense as well. You can always say, we're following CDC guidelines, and I'm sorry, I can't allow you to come in and jeopardize the health and safety of everybody in here. That's one method. But it's not as cut and dry, so you may have to have some conversations with individual people to get to the right solution. How we doing? Everybody good?
Yes, ma'am. Keep going.
Okay. So now remote work, especially now where we see some state regulations changing a little bit, maybe getting a little bit tighter again, seeing some case numbers and case counts going up. Don't be afraid to keep employees working remotely. So here's what we want to remind you about this. Have a policy in place, but tie the remote working option to the job description. So if you have to take a look at some of your job descriptions and add to a specific job description that this has a remote option available, that way you're not opening yourself up to any potential discrimination. So if it's tied to the actual job description, then anybody in that particular job will have the option to work remotely if they choose to, or if you allow that. So take a look at that and create a policy that matches job descriptions and not necessarily individuals. You may have some people that say, oh, I want to work remote, but you want to pull it back and tie it to that neutral job description, and then anybody in that can have the option. That's the best way to do it. And again, monitor performance the same, monitor expectations the same, and think about some of the other things that you want to double check on. What does your work comp policy cover? And manage those people in the same kind of way. If you have remote positions now and you can keep them remote, it might be a good idea. And then you can keep the attendance in the office a little bit thinned out until we get to the other side. So we've had some interesting PTO and paid time off questions that have come up, and they're mainly, what do we do with all the unused time? If there are people accruing time and people haven't been able to take vacation right now because it's so crazy, or they're busy, or you just can't do without people, or you've got people out so people can't use their vacation or whatever it is. Or if we have businesses that are really in trouble and need to lay people off, but they've got these huge PTO payouts that they're facing, what do we do about that? So there's a few different angles here on PTO that we want to talk about. So first of all, figure out what is your particular PTO situation, and then take a look at your PTO policy. Be careful about what's been written in your policy. You don't want to just make changes to your policy now that are contradictory to what's written in there. So be very careful about things, the time that's already gone by, and how does your policy define using PTO. So having said that, let's dig in just a teeny bit more to that. So if you've got a lot of people who haven't taken time off, you've got all this unused time, and they're either going to lose it or they want to take it. So think about maybe doing, and you can't do without everybody at the same time. So think about creating some blackout days. Maybe you have certain days that nobody can take time off, or if you want to create not more than 3 people can be off at one time, or not more than 5 people can be off, whatever. If you want to say, write it out again, make sure you're aware of your current policy, and then write an addendum to the policy. Because of the pandemic, we are making some changes to the usage policy. Here's how it looks. But again, you want to be fair. So if you create blackout dates where you say these dates we can't be without anybody, that's okay to do. Or if you say we're setting a cap on the number of people who can be out at one time, that's okay to do. But then how do you manage that? So first come, first serve. So people send in their requests for time off and you just approve them as they come in, or based on seniority, or think of some neutral way of determining who can be off when. But be careful about being fair about that. And that way you don't end up with everybody off at the same time, or somebody offended that they didn't get their time approved. Be careful about doing that. Now the payout. There are a lot of jurisdictions in the country where accrued PTO is considered wages earned. So that means you can't take it away. If they leave, you're paying it out anyway. So be very careful about that. If you are in a place where that's okay to do, where it's not necessarily considered wages, we don't recommend that because of the hit to morale. What happens there is they say, well, they just took away all of my PTO, which they perceive as pay or wages, and then that looks bad, and all of the other employees will see that happened, and so that's going to really have a negative impact on morale and on your turnover and on your workforce. So that is not a recommended solution. One thing that you could do is you can change the cap. So if you have a cap set at 3 weeks of PTO accrual, you can reduce the cap. It doesn't take away anything earned from somebody, but it doesn't allow people to go higher at that point. So you can reduce the cap. Once they use time, it will just start to decrease. So something to think about there, reduce the cap, or, make some changes to how they can use it, or how it can be paid out, or the time frame and whatnot, so that you can get them down to a lower cap. And then if you do lay employees off, the expectation will be to pay out that PTO. So be careful about that. Understand what your current policy regulations are and how your wording is, and be very aware of your state and your jurisdiction's guidelines for PTO. Is it considered wages earned? So I want to talk about travel because this is an issue now. If somebody does take vacation and they're traveling, what if they go to a state where they've got a high number of cases? There are a lot of states out there right now that have some travel restrictions in place, meaning that if I go to a state where they have more cases and then I return to my state may have a requirement in place that requires me to quarantine for 14 days. So again, these are conversations. I have seen we have seen some of our clients ask about implementing a travel policy where they agree to not go to certain states or whatnot. We feel that they're just a little bit too restrictive, so I would be careful about doing that, but don't be afraid to have the conversation. Ask people if they're going on vacation, hey, where are you headed? Do they have a restriction? When you come back, do we have an issue? If somebody goes to a state where the cases are high and their current state where they live has a quarantine in place, that would then make that individual eligible for paid leave under FFCRA upon return. So having a conversation, understanding, even though people are going on vacation, it may be PTO, it may be none of your business, it kind of is your business right now. It's okay to ask. And it's also okay to say, make recommendations, please be aware of social distance and safety when you travel to these other places, and keep that in mind. So conversations are allowed right now about these topics, and don't be afraid to have them. So off-duty behavior kind of goes together with our PTO. There are some places where there may be a quarantine or a stay-at-home order or an issue surrounding that. And if somebody is told, typically, we don't really worry about what somebody does off-duty. And it's none of our business. We don't care. Here's what you have to do when you're at work. You have to behave and follow our policies and our code of conduct and whatnot. We don't really pay attention to what they do when they're not at work. However, in this day and age, number one, we're in a pandemic, so things are a little bit different. And number two, with social media, you can pretty much see what people are doing all the time, unfortunately, more than you want to see. But if somebody is told by a healthcare provider to quarantine and they are told to stay home, and then you see them on Instagram partying it up all weekend with a whole bunch of people, we have seen this case as grounds for termination. Again, it's a conversation. You can't just jump to conclusions based on what you see on social media, but I think it is worth a conversation. If you know somebody is out and they have coronavirus or they've tested positive, they've got symptoms, and they're still out putting other people at risk and in danger, then that puts your other employees at risk. That puts your business at risk. So it is okay to address that in that exact example. Now, if somebody, if it's not that cut and dry, it might be harder to really have a conversation about termination, but you can ask people to stay at home without pay if you see them in an environment that can be challenging for the safety of your clients and employees. So again, it's a conversation. It's not always that easy. Like we talked about with travel, it's okay to ask them, where did you go? And also, why did you go? If you sent somebody to another state or traveling as a course of business, then that's a different conversation versus somebody went on vacation to a state where the case count is very high and then returned. So the conversation is important there. Why did they go? Where did they go? That kind of thing. Are they going on your behalf, or did they just go visit friends in another area? And as always, follow CDC guidelines. Social distance is a safe bet right now. Masks are a safe bet right now. We have to do as much as we can to protect ourselves, to protect the people around us, to protect our family members, to protect our businesses, to protect our clients. So do the best you can. Follow the CDC guidelines right now and social distance whenever you can. So going into my final thoughts, all of the same thing. Remember, we're coming up with all of these ideas and protocols for today. This is what we know right now, and all of this will help you today. It is going to change. The landscape is changing daily, and no worries, we're going to help keep you up to date on that. But all of this information, again, is pretty much for right now. Communicate with your team. That's the biggest thing. Don't be afraid to have conversations, talk to people. And because we're in a pandemic, things are a little bit different. You're allowed to have more conversations than you normally would. And so that's kind of the best way to handle things right now is communicate. Be as transparent as you can. Ask questions that are directly connected to your business and to the safety of your staff and your clients. And as always, do the best you can. You know, that's just kind of where we are right now. We have to do the best we can and just get through this together. So that's what we've got for today. Any questions?
Actually, Rachel, I do not have any questions.
That is a first.
Right? If anybody has any questions, now's your chance.
Yep, don't be afraid. And as always, we're here for you guys. We're really happy to have you join us on these coffee breaks. It's been a great addition, and we plan on bringing you some really exciting topics. We are going to talk about politics in the workplace coming up pretty soon. How to spot a liar is on the menu for coming up shortly. We're going to probably revisit some new Senate and House bills that might come out in the next couple of weeks. So we have some great topics coming up, so you can look forward to that. I hope you all have a delicious coffee this morning. Rachel, yeah, we have a question.
We have a question. What are some of the best ways for HR to track and document COVID-related leave?
Okay, so we have a great form. Cindy, where do we have the form? Can somebody go grab it, or do we need to send it out?
I think it's on the share on the website. I'm going to have to double check. If not, I'll figure out a way to get it. We'll figure it out.
Yeah, we'll make sure everybody gets a form. But so we have a form for the FFCRA leave. As soon as somebody thinks they might be eligible, we've got an electronic fillable form that you can email or send to employees, and so they can fill it out and get it back to you. Now, some of you may have CertaPay payroll and some of you may not, but CertaPay has some great tracking methods in place. We actually code the time. So when somebody is out for 8 hours unpaid leave under FFCRA, it's coded that way, and then we can pull reports based on that. So if you don't have our payroll, then we recommend just tracking it on an Excel spreadsheet. This will help you when you're doing your 941, so that you can show exactly what wages were paid and how much you will get as credit against your taxes due. So if you don't have our payroll process in place, then just track it using an Excel spreadsheet. If you have some other payroll provider, ask them if they can track FFCRA for you so that you can pull reports and use that information. Now, if somebody is, we've got school that's going to be starting back up. Some people are going back to school in the building. Some people are going back remotely. So this may create that expanded FMLA option for your employees. If somebody's child cannot physically go back to the building, then they would still be eligible for that 2/3 paid leave for that up to 12-week window. So make sure you're familiar with the school laws, who's going back, who's not, those kinds of things, and then see if people still have time left under FFCRA.
Couple things. I do know that it was sent out to anyone with payroll on April 1st. However, Laura was gracious enough to put it into the chat box so you can all grab it right there. But I do have a few more questions, Rachel, if you're ready.
Nice. Thanks, Lori. Yeah, go ahead.
The next question, I'm in California. If we lay some people off because we cannot open our indoor dining for the last 4 months, are we required to offer them work if and when we reopen? We currently are not planning to rehire for the positions.
So you are not, because that is considered a layoff due to lack of work. So all of those individuals would be eligible to apply for unemployment. And when you are rehiring, you can choose to rehire any of those individuals, or if you're not adding back the position at all, then obviously you're not rehiring. So what I would caution there is if you received the PPP loan, and if you did receive the PPP loan, then your head count does matter. And you would have to, at the point when you apply for forgiveness, you would want to make sure your head count is up. Even 1 or 2 employees less can dramatically impact your forgiveness numbers. So keep that in mind when you're doing that. But when you lay off, if you are eliminating positions, no, you don't have to pull back all the same people if and when that time comes.
Next question, if an employee is over 65 years old and elected to stay home in March, they are still out. When they do return, what is our obligation to their status and schedule? Do we have to, did you just answer that one, Rachel? No. I'm sorry, guys. I thought it was the same question again. Again, the individual 65, they've been out since March and they're still currently out. When they do return, what is the obligation to their status and schedule? We had to hire new employees to provide service to our members. Are they guaranteed their schedule prior to leave?
So the key word in that question is elected. So while the CDC made a recommendation for anyone over the age of 65 to self-quarantine, that was not an automatic guideline for approval under FFCRA. So there are no protections in place. That individual elected not to come. You had to fill the position, probably because you had a PPP or because you just needed somebody in the position. And because that person did not work at that time, you are not obligated to bring that person back at all. Now, maybe you had conversations with that individual and you said, okay, fine, let us know when you want to come back. But when that person comes back, you have the option to change the role. So if you bring them back, you can say, listen, I only have a part-time spot for you. That's okay. Or I have this position available. If the position they were in is no longer available, then they're basically eligible to reapply for a position that might be available at the time when they're returning. So that elected to stay home is somewhat equivalent to a resignation.
Next question. If you ask an employee to stay home due to not feeling well, but do not know for sure if it is COVID related, do we have to pay them?
So under FFCRA, it's very specific. It's not just, I don't feel well, I'm staying home, so therefore I get paid. It has to be COVID-19 symptoms, which we all know now is a very long list of symptoms, but they have to be seeking medical attention. So they can't just say, I'm sick today, I'm not coming in and get paid for it. It has to be they are sick enough with symptoms that they are seeking medical attention. Now, maybe they just call their 1-800-MD number. Maybe they have a virtual appointment with a doctor. Maybe they actually go to a facility. Maybe they're getting tested. But it has to be kind of a two-step. It's not just, I don't feel good, I'm not coming in, I'm taking a sick day. That's different. If somebody is out with symptoms and seeking medical attention, they qualify for FFCRA. Now, let's say it's not in that level. Let's say I was out. I'm out because I have terrible allergies, and it's one of those days where I just can't deal with it. I need to take a day off. Well, is there PTO? Can the individual take a sick day under your program and just use PTO for that day? So, but again, you have to be careful about that. You can't require somebody to use your sick time or your PTO time to prevent them from using FFCRA. You want to ask the questions if FFCRA applies. So what are the symptoms, and are they seeking medical attention? Then yes, they would qualify for paid leave. Perhaps they already used all of their 80 hours of paid leave under FFCRA. Now you think of, is there any PTO available that they can use while they're out, or do they just need to take an unpaid day because they're too sick to come in? Again, these are conversations. We're in a different time. None of this stuff is just as black and white to answer. We have a lot of gray areas, so the conversations will help you get to your answers.
All right, Rachel, the next question has to do with headcount and the PPP loan. It says, our audit firm told our CFO that headcount may not apply to us. Do you have any idea what the audit firm might be referring to? I asked the CFO for more information and have not heard back.
I would need more information to answer that. So I think that's Lori. Lori, if you want to give us a ring after, or reach out to us via email, maybe we can connect. Headcount is very important. So there may be some cases where, I don't actually know of cases where headcount doesn't matter. So just reach out to us after, because headcount is very important. So the thing that is different there is,
there's got to be a reason.
Is you may, yeah, I'm sure there's some more information there, but I would need more information to answer that just right, because headcount is important. If you've reduced the headcount significantly, then it reduces your forgiveness amount.
Someone did chime in and say that headcount doesn't matter if you did not reduce salary below 25%, and also if you did not reduce headcount. That doesn't.
Yeah, it matters.
It matters.
Headcount matters. Yeah.
Yeah.
That's okay. I think there's more to that, but I can help with that answer if we go more into it.
Well, that was the last question I have or had. So anybody, anything else,
Great.
folks? If not, you can always email or call Rachel and I. Hang on, I just got another one. What if they want to stay at work but have horrible congestion and you ask them to go home and be tested, but they do not want to be tested because they think it's allergies? Do they have to be tested, or can they return after a set number of symptom-free days?
So if somebody has symptoms, you don't want them in your workplace. You know, they can say it's allergies or whatnot, but it's okay to say, listen, we're not taking risks right now. You have symptoms. So you can't be here until you're symptom free. You cannot tell people they have to get tested. So if somebody just doesn't want to go get tested, that's fine. You can't demand that they do it, but you can say you can't be here if you have symptoms. So then you can send the individual home and say, you know, fine, you can use your sick time, or it's going to be unpaid time, whatever. Let us know when you're symptom free. And yet, if they have no symptoms and it's been several days with no symptoms, with no medications, and they're okay to come back, then, you know, again, it's worth a conversation. You want to be careful about that one. But it's okay to send them home. You know, you can't be here if you're sick. That's that.
Rachel, what about the catch-22 that you can't require I get tested, but you require a doctor's note for me to return to work?
So you really don't need any doctor's notes right now. I think if somebody has symptoms, ask them. Do you have symptoms? If they say no and they come back and they're coughing all over the hallway, then you know they have symptoms. But you don't really need a doctor's note for somebody to return. Now, you can ask for that if you want, but again, the healthcare providers right now have said, please don't send people for doctor's notes. We just don't have the bandwidth to do it. So try to figure out the best solution without doing that. And if somebody is saying that it's just allergies anyway, they're probably not seeking a doctor in the first place. So you don't want to send them unnecessarily to have the expense of a doctor visit just to get you a note. So be careful about doing that right now.
Okay. That's it. We appreciate everybody.
All right, guys. Once again, thank you so much for joining us every week. We're glad you're here, and we look forward to some new and exciting topics and continuing to provide you some relevant information as we move through this together. CertaPay thanks you for your business, and we appreciate you, and we are here for you. Thank you so much.
Just a quick reminder, all past coffee breaks are on our website at CertaPay.com. Over to the right-hand side, you'll see the news icon. If you drop that down, the last one would be coffee breaks.
Yeah, good reminder. And we have them all up. So all of the previous coffee breaks are on our website. Find us there.
Stay tuned for our next installment.
That's right.
Oh, there we go.
All right, guys, have a wonderful day. Thank you so much.
Day.